Hello everyone, my name is Masisa Sikbe and I'm one of the future Chief Radiology residents at UCSF. I'm going to be doing a quick review on this paper that deals with post-vaccine adenopathy and imaging in the setting of recent COVID-19 vaccination. This is one of the top publications in radiology in 2021 because it was one of the most viewed articles, has the highest altmetric score, and then is also one of the top cited articles of the year. It deals with a clinical scenario that we deal with commonly on service now, which is this isolated lymphadenopathy in the setting of recent vaccination. These recommendations of the article can be divided into three discrete categories that inform our practice. The first is what we do before the patient comes for their imaging. The main takeaways here are not to delay vaccinations or urgent imaging given their clinical benefit, and then also to make sure that we vaccinate patients on the side opposite their malignancy and cluster doses on the same side to avoid confusing the clinical picture. When the patient shows up for their imaging, it's important to document these vaccine details, share this with the radiologist, and that for the report findings to be interpreted in the context of their vaccination. After imaging, it's important to realize that we do not have to default to follow-up imaging if the most likely cause for isolated lymphadenopathy is recent vaccination. If there's any ambiguity about the etiology of this lymphadenopathy, we can consider targeted ultrasound to follow up those lymph nodes and then do tissue sampling if indicated. While this article was published about a year ago, its principles are very helpful as we look towards the future and deal with this cycle of seeing new variants, new vaccines, and then new subsequent lymphadenopathy, so the principles will hold true for the near future. This article is really my main reference for this presentation, and all other figures are original artwork created by myself. Thank you very much for your time, and please reach out with any comments or questions.